A young man walked into my office and he came with a result. Okay, he came with a renal function test, and I looked at the result. I saw creatinine high, urea high, GFR was 15 or 14 thereabout. So I was so worried. I was like, "What happened? How old are you?" He said 24, and I asked him, "Okay, why did you do the test?" And he said he woke up one morning and he just noticed that his face was swollen, and he asked ChatGPT and he was asked to run a kidney function test, and that's why he did it, and he had to see a doctor to help him out with it.
Our hearts beat to the
I have noticed something very, very important that we really need to sit down and talk about. And that is the fact that youths are having high blood pressure now. And I was talking to my friend, a colleague, about the fact that some patients have been seeing now, young patients have been seeing are hypertensive and they are in their early 30s, late 20s. And she also pointed out that she saw a young lady that also has hypertension. And that led me to doing this video. So today is health o'clock. So I'm going to do a health video today. Before then, I would like to tell us the story. Last month, a young man walked into my office and he came with a result. Okay, he came with a renal function test, and I looked at the result. I saw creatinine high, urea high, GFR was 15 or 14 thereabout. So I was so worried. I was like, "What happened? How old are you?" He said he's 24, and I asked him, "Okay, why did you do the test?" And he said he woke up one morning and he just noticed that his face was swollen, and he asked ChatGPT and he was asked to run a kidney function test, and that's why he did it, and he had to see a doctor to help him out with it. So I was like, "Have you had, is there anything you are feeling? How is your BP like?" He said he has BP, high blood pressure. I was like, "Okay, please, what was the value?" He said he normally gets 170, 180, but then he's too young to take BP medication. I was like, "Okay, so for how long have you been having this value?" He said he noticed it early this year. And I said, "Okay, why didn't you take your medication?" He said that he feels like it's too early, and some person said once you start taking medication for BP. And I said, "Did you see a doctor?" He said no. "Who told you that?" He said people. And I said, "Okay, what was the highest value you've had?" He said he has had 200 over 110 at a point. And I asked him, "What did you do?" Because I know that if you have that kind of value, you would want to do something. He said he didn't. He just went to a pharmacy shop and just took drug and it brought it down, and then he continued his activity. I said, "Okay, you have to go and do urinalysis." So we had to check his urine. We did an ultrasound scan, fast investigation that we can actually pick out something. So we observed some changes in the kidney leading towards chronic kidney disease. BP was 170/100 that day. So I immediately referred him to see a consultant nephrologist. After he met him, he was booked for dialysis and every other thing. I had to follow up the case because, of course, I'm going to be an internal medicine physician. The truth is that it was something very painful. We were not happy with that establishment because these things are things that would have been resolved if it was followed up. Okay, the high blood pressure is no longer the old man something. It's something we now see in young people, and most times when you see that a young man, a young woman is having high blood pressure, don't be so quick to commence antihypertensive. Most times the cause of their high blood pressure is usually secondary. So now, what is hypertension? When the blood pressure is consistently high with these values, the systole, that is the one up, is 140 and above, and the diastole, that is the one down, is 90 and above, or any of them. Either the systole is high or the diastole is high or both of them are high. So that is hypertension. Because some persons will come and tell me, my blood pressure is just one that is high. The down one is just 90 and the up one is normal. Or the down one is 100 and the up is normal. So I don't have hypertension. No, either of them can be high consistently. When getting high value one time does not diagnose hypertension. It should be consistent. When you have a relative and you checked your blood pressure for the first time and it's high, check again, check again. If it's high, please come and let's follow it up. I understand our country, and some drugs can easily be accessed. We have chemists, we have pharmacy shop everywhere, so you can easily walk into any shop and tell them my blood pressure is high, and they will give you medication and you start taking. It is not all high blood pressure that should just be treated like that. It is not all high values that should be treated like that. And that will bring me back to secondary hypertension. The truth is that if you are less than 40, most times the hypertension you measured could be as a result of something, an underlying disease. For example, if you have something like renal artery stenosis, that is, the blood supply to your kidney is reduced, you would have hypertension. If you have some kidney problems, you have hypertension. If you have some hormonal problems like hyperaldosteronism, hyperthyroidism can also cause hypertension. Sometimes it doesn't happen like that. But I've been seeing some persons with swollen neck. There's what we call hyperthyroidism. There's also what we call hypothyroidism. This thyroid hormone here can produce hormones that are in excess or might not even be producing hormone. So either of them can cause hypertension. Just that the is if it's systole, it can be hyperthyroidism. If it is diastole, it can be. But that's for doctors. Okay. In fact, I should educate everybody so that you know, right? So both of them can cause hypertension. So hypertension is not just something that can happen just like that. I understand that some persons, like my friend once told me that there was a lady that presented when she was in cardiology department. A lady presented and they explored everything but could not find out the cause of the lady's hypertension. So they tagged it primary hypertension. So before you tag the hypertension primary hypertension, make sure you've explored everything. So if you are a youth and your blood pressure is high, the first place to present is not in the chemist shop to give you amlodipine, because that's the commonest drug everybody take. You know, some people even use some drugs that you'll be shocked they are using. Some youths will tell you, I'm not having symptom, I should have symptom. Let me tell you the truth, hypertension does not come with symptom when it's starting. Most times you don't even feel anything, you just present for a regular check up and then you notice that your BP is high. Some people will tell you that they want to be having headache. Yes, headache is a very important thing. Headache is a sign that you have hypertension, but it can also be a sign of other things. So don't just depend on when you have headache before you start checking your blood pressure. It should be something that you routinely check. And you know one thing about our parents, they do check these things, but youths, we don't, because we feel like it's not something we can have, right? So I've noticed, and I'm making this video to tell everybody that hypertension in the young is no longer something that we are far away from. It is something that is happening. I've seen a lot of persons come down with hypertension, and there is something we call hypertensive nephropathy, no repo. So hypertension can actually cause your kidney to be damaged if you don't manage it. So whenever you discover that your BP is high, don't present to the chemist shop, present to the hospital. You will still patronize the chemist, because when the doctor writes the prescription, you will take it there, but make sure a doctor is the person prescribing the drug after thorough examination, after thorough check up.